My name is Nate Miller, and I'm a student physical therapist with Campbell University. Today, we're going to be talking about the McMurray's test. The McMurray's test is a test used to determine the presence of a meniscal lesion of the knee. For the specificity and sensitivity of the McMurray's test, a recent meta-analysis compiled a bunch of articles and reported the sensitivity of the test at 55% and the specificity at 77%. Now, there is some controversy as to these numbers because if you look in the literature, you can find many articles that have a wide range for both of these values, anywhere from the lower 20s to the upper 90s. And this is attributed to low methodological quality, some sort of error in the test, or using it on different patients that are not consistent throughout the study. So there is some controversy there. However, this test is most useful when it's combined with a battery of tests to assess the presence of a meniscal lesion, such as joint line tenderness and the Apley's test. So using the McMurray's together with any of those tests definitely makes it stronger evidence for the presence of a meniscal lesion. So we have a model here to illustrate how we're going to be using this test. And you want to stabilize the patient's foot with your hand. So just wrap your hand around the foot, and this is going to allow us to have a lever to internally and externally rotate the tibia. The other hand is going to be palpating the joint line. You want your thumb on the outside of the knee and your middle finger on the inside of the knee. And this hand is going to be responsible for applying valgus and varus stress. So to assess for the medial meniscus, we're going to flex the patient's knee maximally, and we're going to apply a valgus stress directed medially. As we're applying this stress, we're going to externally rotate the tibia, and once we have those stresses, we're going to hold them and extend the knee fully. Then we return to flex position, and to assess the lateral meniscus, we're going to apply a varus stress, or laterally, and we're going to internally rotate the tibia, and then we're going to extend the knee. A positive McMurray's test is denoted by a thud or a click that is heard or felt, and the reproduction of pain. So I have my patient here, Richie, and I'm just going to explain to Richie why we're going to use the test and what we're going to be doing. So Richie, we performed a knee evaluation on you, and I'm suspecting at this point that you might have a lesion in your meniscus. The meniscus is a piece of tissue that sits on the outside and the inside of your knee, and this can be damaged in a twisting motion similar to what happened to your knee. So what I'm going to do is I'm going to move your knee upwards, and then I'm going to be applying specific forces that will target those menisci. And then I'm going to extend your knee. As I'm extending your knee, I want you to let me know if you have pain or you feel a click or a thud, okay? All right. So we flex the patient's knee maximally. Our lower hand is grabbing the foot, wrapping it around. Our upper hand palpates the joint line. Again, the thumb is on the outside of the knee, the middle finger is on the inside of the knee. We're going to start by assessing the medial meniscus, so I apply a valgus force, or a medially directed force, as I externally rotate the tibia. We hold those forces, and we extend the knee. Any pain with that, Richie? Good. We then move to the lateral meniscus. So we apply a varus force at the knee, or a laterally directed force, and we internally rotate the tibia. We hold those forces, and we extend the knee. Any pain with that, Richie? Good. So Richie has a negative McMurray's test, so that gives us a small piece of evidence that he doesn't have a meniscal lesion, but of course we're going to follow that up with more tests such as the joint line and the Apley's test to make sure he doesn't have it. You need to... Did I make an error?
Yeah,
I did?
he said